and thank you for your patience and for being here with us. I think we've seen wonderful examples of novel uses and needs in digital health. I will talk about it from maybe a slightly different perspective from what we've seen, but somehow the dots will connect. As I mentioned, I'm an academic. I do research in psychology and medical decision-making. Have been doing it for quite a while. At Wharton, at Princeton, and publishing on the topic, sometimes with this wonderful physician over here, Dr. Stefan Becker. I have considerable industry experience, and I'm mentioning that because having academic experience is just not enough when you're dealing with medical decision-making. So I have a consulting company where I work with pharma, with health advertisers. That's a wonderful way of seeing what works and what doesn't work. So when I look at, for example, diabetes interventions, I know what they look like when they commercialize and how many or how few patients will uptake the solution. There's a bunch of things that I do. You get the message. I have my own startup company, Body and Soul, with the idea being that behavior change is incredibly difficult, and in order to engage patients, we have to entice them, we have to help them in a much broader way, and we have to talk to them about their life journey, creating something that is astigmatized and brings them in not just as patients, but as people, because we are always people and we're always growing. I'm going to talk today about trends in digital health, and I'm going to start super optimistically, then I'll spoil the party a little bit, and then we'll see how we can make it better maybe for next year or years to come. So trends in digital health are basically that we're moving forward very, very fast. We're moving toward disease management more, and it looks like we're making incredible progress. Martin Pfister reminded me that the first FDA digital drug was approved today, and that's amazing news. So we are making unbelievable progress, and I'm sure he'll talk about it over the panel. Where else are we making progress? There are over 300,000 health apps. It's a phenomenal number. We've never had this many health apps. However, when you look at them, you see that they're converging. There are multiple apps. A lot of them don't get downloaded more than 5,000 times. So the market is big, but it also needs to converge. And I'll talk about that in a minute. And we're shifting toward disease management, but not completely. There's still, I'll get there. There's clinical evidence that digital health is helpful. In 2010 and 2011, people would talk about, well, there's engagement, there are downloads. They didn't talk about clinical outcomes. We're seeing many more clinical outcomes now. We're seeing systematic reviews. We're seeing the best journals addressing digital health. It's there, and it's there to stay. So this is wonderful, right? Well, it's getting there. The potential is very, very big. Use of health apps in 5 therapy areas. Diabetes is obviously one of them, but also asthma, diabetes prevention, pulmonary rehab, and cardiac rehab could produce $7 billion in savings. That's an enormous amount of money. This is, of course, based on the assumption that people will use it. What we're also noting is that there are no spillover effects. So if you create a solution for one disease area, that doesn't necessarily help in other disease areas if you think of a patient that might produce considerable burden upon them. Again, really fantastic news. Very recent article from Health IT News. Digital health has the potential to save $46 billion a year in health spending. That's a lot of money. When we look at it, we need to divide it. Who are we saving the money for? Is it for health systems? Is it for clinics? Is it for patients? When you find a paying point, you find a pain point, and then it's easier to sell to whoever is going to incur the largest savings. These are slightly older statistics, but they bring us to the point where we need to worry a little bit more and to plan a little bit better. The average age of the person using mHealth in 2013 was 35. That's not your chronic disease patient. That is someone who most likely is pretty healthy. That's why I put a red point up there, because I found it slightly worrying. potentially worrying. Do doctors recommend health apps? I have the statistics from 2013, but let's do a little survey here. Has any of you ever been recommended a health app by your doctor? If you have, please raise your hand. I'm not raising my hand because I was never recommended a digital health app. Is there anyone here at all who was recommended a health app? No one. Thank you. I hope everyone here is incredibly healthy and will always be, but are we always really incredibly healthy? I don't know. Is this the reason why we were not recommended? I'm not sure. Are we running very, very fast with digital health? And the doctors are playing a somewhat different game. What else should we be worried about? Millennials really like digital health services. Well, guess what? Millennials are usually pretty healthy people. Old people like me, who are between 35 and 54, like it a little bit less. And boomers, who are 55 and above, are not that crazy about digital health. What are you going to do when these people need it more than anyone else? What else should we worry about? Well, it's not really something to worry about, but it goes hand in hand with the issue of young people using digital health. What do we mean when we say digital health? Are we talking about fitness? Are we talking about how fast you run? Or are we talking about, are you controlling your blood sugar level? There are 24% of digital health apps that actually deal with health and disease and treatment. That's a small portion of the booming, enormous digital health market. This looks very benign, but if you read the title, I think you start seeing the disconnect. According to a report by IMS Health from 2015, 1 in 10 health apps connects to a device. That's great. 1 in 50 connects to healthcare providers. So we have the patient, maybe the patient and their device. We have the physician, and we have a disconnect. If you look at physician burden, you can understand why there's a disconnect. But if you think about where does the patient need the clinical input, and how does the information from the patient's measurements and devices connect with their clinical treatments, you might see that there is a problem, or at least that there's potentially a problem. Trends in digital health to keep an eye on from Quora are digital health interventions will be something to look for. Hello, this is why we're here. Provider-centric solutions, and I think we've seen a number of them here, very, very inspiring ones. Big data analytics, and new model insurance companies. That's we're not dealing with. So this looks very promising. This looks great. I think we have other things to look at and to maybe be concerned about. And I wanted to cite 2 papers. Maybe we'll just make one that I wrote, again, with Dr. Stefan Becker and with colleagues. In this one, we looked at real patients, at people who have high blood sugar level, who are age 60 and above, and who are not necessarily very tech savvy. We asked them about blood sugar monitoring for their diabetes. What we found was that only the tech savvy patients, the one with a positive approach toward technology, were going to use a device. That's a concern, because that's only half the patients that we surveyed, and these are patients who agreed to participate in a study. This isn't the entire patient population. You can guess what's going on there. Something else that we found, which is not coming up, that's okay, is that the patients were concerned about their doctors. They said, wait, I'm going to have measurements on my app. This is very nice. Where does the doctor get in the picture? Does my doctor know? Well, let me tell you something. Their doctor doesn't know. I ran the Health 2.0, the Pharma 2.0 series in New York City's Health 2.0. The doctors just cannot be brought in the mix every single time. They're not interested. It's not going to happen. So this is something to look at and to consider. Another intervention that we did was with an adherence device on an iPad. And there we went even farther. Just, Stefan, would you mind checking what happened with the slides? It's like the end disappeared. And there we went even farther. We gave iPads to old patients, really old patients, age around 75 up to 85. People who never looked at an iPad, they didn't know. We had to put a sticker on it to say, where's the on button? Because there really isn't an on button. And what we did was we made home visits. This is low tech. This is as low tech as it gets, to go to someone's home, bring them an iPad, put a sticker where the on button is, program it for them. Incredibly low tech. But guess what? It worked. And these seniors ended up really liking their, it's not working, really liking their adherence devices, using them, preferring them to pen and paper, adhering more to their medication, and we didn't have enough to see if it really made a difference with their blood sugar level, but it seemed like they were measuring more frequently. What this teaches us is that we're very technologically advanced, and this is wonderful, but that's not all that we need to see, so I'm going to caveat this. I'm a psychologist. Psychology is my hammer, so everything I see is a nail. I see the need for psychological integration, but I think it exists both with patients in terms of their uses, and not just UX and UI, because it can be a beautiful device, and iPads are beautiful, but if you give my mother an iPad, she's 86. She has no clue, and that's fine. It's not her job to figure it out. It's whoever's creating the device's job to make it very easy for her, or the health system who wants her to use it to moderate this usage. Otherwise, we will be catering to the patient population of people who are around age 35, who are much more interested in their Fitbits than they are in blood sugar level. They may not be experiencing this need. That's the first point I want to make. The second one, yes, thank you. I wasn't lying. The second one is about how do we bring the physicians into the mix. With over 300,000 digital health apps, we cannot expect the doctors to know each and every one of them. We're seeing that there's a convergence, there's standardization, many people using very few apps, and that is fine. In a way, this is okay. It's okay because we all use Google now, and we all use various services, and we shop from Amazon, and things converge because they're easy and they're standardized. I'm not advocating for one only market, but I'm saying this makes things a lot easier and a lot more feasible. This is the study I talked about with Dr. Stefan Becker. So what do we need to look at? We need to look at patient usability, comprehension. This is something I have numerous studies about. You cannot believe how depressing it is to run a study on comprehension because comprehension is poor. Don't ever assume that your patients know something. Half the time, you are wrong, even if it's something very, very simple. The second thing to worry about is physician integration. Don't assume that if you're creating something that's wonderful for the doctors to use, they'll actually use it. They'll actually take the time, and time is very, very precious for them to learn it, to integrate it into their system. Thank you very, very much for coming to this wonderful event. I hope you learned about it as much as I have in preparing these slides and thinking about all these trends and wondering what we're going to see here in our event next year. And now, thank you.
Well, thank you very much for the presentation. It was even better without the slide. Thank you for this technical challenges. I think we've got time for 2 questions from the audience. Any comments?
Thank you. Just quick question because I'm a resident doctor and self-monitoring and empowering patients is always a great idea. But what do you do specifically to keep doctors in the loop? Like you mentioned previously that they kind of are dropping out from the loop and healthcare, and some patients actually say, you know, why do I need doctor? I got Google, which is seems to be a bit crazy from my point of view. So, and the second part of the same question, some doctors are more tech savvy, others are less tech savvy. Is there research on that, how to integrate and help out doctors to actually use new tech to actually assist their patients and improve better healthcare?
These are like 7 questions, and each one is better than the other. I'm not even going to start with Dr. Google. You say it's crazy. I agree. This is crazy. I once thought I had lung cancer because I had bitter taste in my throat, and that's what Google said. No, it was because I was drinking soy milk. So I had a few very, very sad weeks thinking I'm going to die. Then I turned off the soy milk, and everything was fine. So that's my little blip on Dr. Google. I think we need to give value. We need to give value to patients by not just measuring, but also explaining, showing them what to do. That's more of a question of how can they use digital health. They'll use it if they see something is coming out of it. Why would they go to the doctor? Because they see value in bringing this input to the doctor. Why would the doctor be in it? If we make it easy for the doctor, if it's not just burden. If you're a doctor, you don't want to go home and check your email and see this huge log of data that you're now obligated to look at. If there's value, if there's a summary, and I think the imaging companies that were here were tackling this challenge. So many images, what am I learning? One of you guys said green or red. I don't know if we can go to this level of binary information, but if you summarize it and make it easy for the doctor, again, don't assume. Don't assume that if the doctor is young and super tech savvy, they have time to learn your machine and they want to integrate with it immediately.
Thank you. Last quick question.
You talked about 5 areas in which most of the apps are, right? Besides that, I mean, medicine is a big field. Any other areas where these kind of apps development can be helpful? Because everybody seems to be just running into these 5 areas.
It's really a great question. The truth is that value can be found in very big numbers, and I think that's why a lot of people are going to diabetes. But I happen to work with pharma on rheumatoid arthritis. I worked with maybe 3 or 4 companies on rheumatoid arthritis. There aren't that many patients, but each patient receives very expensive drugs. So I would say, and it's a sad answer, it's not my value system, but it's practical, I would say follow the money. Where there's money, with rheumatoid arthritis, there's money. Pharma is going there. If you can bring value, again, it's the question of value, not in terms of human values, but if you can solve a problem, which is a small problem, but is meaningful to a certain amount of people, and someone is footing the bill for that problem, you have something going for you.